Hey, so today we will be talking about exercise and how that affects your psychological well-being. Bear with me as I play the slides. But so basically, in society now, as we all know, there's a lot of increasing demands due to technological advances and expectations from people. More people are working, so more stress equals more illnesses and like regarding to mental health. So these slides are just talking about how like the statistics of the increase in the effects of like the psychological well-being of people and why to exercise for your own psychological well-being. So it has been said that exercise causes a reduction in anxiety and depression and it has positive influences of feelings of well-being in people as it decreases anxiety and depression. There are six dimensions of well-being. There's self-acceptance, which has to do with how you view yourself, which is positive views of oneself. There's the second one, positive relation to others, which is like how you interact with other people and how that affects you. So trusting somebody, caring for somebody, and empathetic relationships, as mentioned in the slide. And then there's autonomy. So it has to do with intrinsic motivation. So how having self-determination, being intrinsically motivated, and has to do with the self and how you navigate the self and how confident you are navigating the self. And then there's environmental mastery. So how well suited are you in your environment to fulfill what you need to fulfill? So can you accomplish what you need to accomplish in your own environment? And there's personal growth, which is a sense of development and self-fulfillment over time. So personal growth meaning you go through life, you learn, and you develop yourself as an individual. The last one is purpose in life, which is directed toward purposeful goals for living. It's self-explanatory. Going to the next slide. Again, going back to the reduction due to reduction anxiety and mental health problems due to exercise. So reading off the slide, mental health problems account for 30% of total days of hospitalization in the United States and 10% of the total medical costs. And a cause-effect relationship has not been established, but it is exercise, if done regularly, is associated with reductions in anxiety and depression. Sorry, sometimes I tend to speak a little fast, but you don't necessarily need to do high intensity exercise. There are other activities such as yoga or any group exercise. It doesn't have to be intense. It just needs to get your body moving. And some people play sports. That also works as well because it's exercise. It has been shown to reduce anxiety. Then there's the difference between anaerobic versus aerobic exercise. So anaerobic focuses more on short-term or short burst activities that don't involve the use of oxygen in the body, such as weightlifting, baseball, as mentioned on the slide. And there's aerobic, which is longer term activities, so like running and stuff like that, that increases like how hard your heart has to pump and like your lungs and obviously this uses oxygen because it has to do with your lungs, and you do need oxygen for this one. Then there's the effects. So acute versus chronic. Acute has short-term effects on the body, meaning you feel really good while you're working out, and then short-term afterwards, right after you leave the gym or whatever you've been doing after your long walk, the effects are reduced afterwards because it's been time afterwards. So then there's the chronic effects, which is the longer term effects, meaning you feel it even days, weeks after you have worked out. So there's the effects that you notice while you're not working out anymore. Again, going back to the reduction of anxiety and depression. So a lot of the research used to explain the relationship between exercise and the psychological well-being of an individual uses aerobic exercise, which is like cardio and like cycling, spin. I teach spin, so that's a good reference. And then activities such as weight or strength training, yoga, and other non-aerobic exercises produce positive effects as well. So the main point of this is that although there hasn't been a direct relationship established between exercise and reductions in anxiety and depression or just mental health in general, there is an association with better overall well-being after um, after performing an exercise or exercising on a regular basis. So going back to the acute effects of exercise, so aerobic exercise is associated with lower state anxiety and higher tranquility scores. Reviews of hundreds of studies involving thousands of participants show general consensus about the positive effects of exercise in reducing both acute and chronic anxiety. Post-exercise reductions in state anxiety return to pre-exercise levels within 24 hours. That's what we were talking about prior to this, which means that with acute effects, you feel it during the workout, not necessarily a long time after you're now working out. This is basically saying longer training programs because of this effect are recommended because the effect lasts longer and you benefit for a longer period of time. And this is showing the difference between aerobic and anaerobic. So for anaerobic, for it to have mood enhancing effects, they're only evident at 30% to 50% maximum heart rate. So in order to feel the same effects as an aerobic exercise for psychological well-being, you would need to be exercising at 30% to 50% maximum heart rate. And even though acute exercise is no more effective in reducing state anxiety than quiet rest or relaxation, the effects last longer. So rather than thinking about how the quality of it, it's more talking about the prolongation of it, so how long it lasts and how good you feel. Exercise training is particularly effective for people who have elevated levels of anxiety, but will also reduce anxiety for people with low levels of anxiety. So it goes for anyone who exercises. It's known to reduce anxiety. All durations of exercise significantly reduce anxiety. Although larger effects have been found for periods of up to 30 minutes, exercise is associated with reductions in muscle tension. So it also talks about physically, like how you feel and the tension in our body. Feeling of relaxation is possible through regular exercise. So anxiety reduction occurs regardless of the type of exercise that you use or how long you do it for or the type. So whatever you do, just move your body and you'll experience effects of the reduction of anxiety and depression. And we have the chronic effects of exercises, which is, again, the effects that last longer even after you're done working out. So physical fitness is possibly associated with mental health and well-being. Exercise is associated with the reduction of stress, emotions such as state anxiety. Anxiety and depression are common symptoms of failure to cope with mental stress, and exercise has been associated with decreased level of mild to moderate depression and anxiety. So chronic has to do with more serious and it lasts longer. So chronic effects are like effects that last longer. So that's what we're looking for people with a higher level of anxiety and higher levels of depression. These are other benefits and also mentions in clinical opinion, which holds that exercise is beneficial emotional effects across ages and sexes. So it has equal effects across ages and sexes, so anybody of any age, of any sex, could experience these benefits. People with the medication, however, need supervision in order to experience similar effects because, as we all know, medication can affect our mood and how we move about on a daily basis. These are some more statistics on how exercise can reduce depression and the difference between back then and now. There is obviously an increase in depression as technology and society advances. So there's a moderate relationship that exists between exercise and depression. There's a correlation, not a cause and effect relationship, meaning they the relationship cannot be explained directly through cause and effect. So exercising does not cause automatic elimination of depression in somebody, but it can have a positive effect on how it is reduced. So there could be other factors that reduce it as well. So exercises could be one of them. Exercise is as effective as psychotherapy in reducing depression. The positive effects are seen across age groups, health statuses, race, socioeconomic status, and genders. Both aerobic and anaerobic exercise are associated with reductions in depression. So any type of exercise, it affects people of all ages, all socioeconomic statuses, and genders. So the longer you exercise, the more benefits you will see. And by longer, I don't mean one single exercise bout, but throughout a period of time. So for weeks, months, years. So the longer you stay exercising and stuff, you will see the more benefits. These are more statistics and more findings. So team sports during high school reported lower depression scores in early adulthood. Sport participation might protect against depressive symptoms in early adulthood. Exercising outdoors compared to indoors produce a more positive effect. Excitement, less fatigue, and reductions in depressive symptoms in a depressed sample. So of course, exercising outdoors can give you more exposure to natural air, more wind, maybe more social aspects, because you're exercising outdoors around more people or around less people if you choose to. So it can affect the way we feel and how it affects us directly, which can again explain why there is no direct cause and effect relationship, but rather a correlation between, because other things can have an effect on how exercise affects us. Then here goes, and says, in a prison population, it was found that moderately intense cardiovascular plus resistance training reduced depressive symptoms over a control group for these prisoners, but also reducing anxiety and hostility scores. So that's again going back to the fact that there isn't a cause and effect relationship between exercise and psychological well-being, but rather a correlation, because there's other factors like the type of training and the intensity of it that can affect how much it affects an individual. While you can see benefits with either or, these factors either increase or decrease or the benefits of exercise. So this is talking about depression and physical activity involvement. So initial research has demonstrated that individuals with moderate or high levels of depressive symptoms were less physically active and were less likely to participate in team sports compared to the low depression group. As age increased from 10 to 19 years old, depressive symptoms tend to increase and physical activity tend to decrease. So of course, as we get older, we become busier and have more responsibilities, meaning we tend to get more stressed, meaning we have less time for things like going to the gym or exercising or just simply making time to move our body. There are implications. Youngsters, especially girls with depressive symptoms, should be encouraged to participate in physical activity and sports, not only to reduce depression, but also to get the benefits of physical activity. So there are benefits other than psychological benefits. There are physical benefits that can help with the development of young people. Exercise and mood changes. So mood obviously can be affected by exercise. If it can lower anxiety and depression, it can enhance mood or however. So this is mood is a host of transient, fluctuating affective states that can be positive or negative. Feelings of elation, happiness, sadness. Mood is generally defined as a state of emotional or affective arousal varying in permanent duration. Exercise is related to positive changes in mood state. Exercise improves positive mood regardless of the number of negative and positive affective states in a given day. So our moods can change any given moment. So exercise is seen to have to be correlated with positive changes in our moods. So when we exercise, we feel much better than when we don't, which is what it's saying. Exercises with choice of exercise mode score lower on negative effect than exercises with no choice. Perception of fitness may be responsible for part of the mood enhancing effects of exercise. So like I was saying, our moods can change at any given moment, and depending on how you feel about exercising, that can also have an effect on how exercising affects your own mood. How to enhance mood through exercise. Use proper breathing, avoid interpersonal competition, so don't try to compete with others. Make it a close, predictable activity. So something you're familiar with, so it can be fun. Use rhythmic and repetitive exercise movements. So movements you can repeat over and over again and get the form right and know what you're doing, and just be aware of the technique and the kind of exercise you're doing so it's not completely new to you and you can complete. Exercise 20 to 30 minutes in duration, moderate intensity, 2 or 3 times a week, which is what is recommended by ACSM. And make it enjoyable, because you want to enjoy what you're doing so that you continue to do it over a long period of time, rather than just trying it once and never doing it again. How exercise enhances mood. So the physiological explanation. So there's an increase in cerebral blood flow, changes in brain neurotransmitters, increases the maximum oxygen consumption and delivery of oxygen to cerebral tissue, reductions in muscle tension, structural changes in the brain, and increases in serum concentrations of endocannabinoid receptors. So this is talking about the brain and our blood flow, and obviously if there's a blockage of any sort with any of these things, it can cause us to have lower moods or have neurological issues or mental health problems, so chemical imbalances, or just in general muscle tension. If you feel tight and stuff, you're stressed. If so, participating in regular exercise can help reduce that that tension, which can help you feel more relaxed and at ease and less anxious. The psychological explanations are enhanced feeling of control. So when you're exercising, you're in control. So it makes you feel like you're more in control of your situation, and you're also increasing your mood. So it helps feel like you're in control of your emotions, yourself, feeling a competency and self-efficacy. So you're doing this for yourself. You're feeling competent because you're doing something for yourself and you know how to do it. Positive social interaction. So things like exercising in a group setting, like group exercise. I keep referring back to this is what I'm familiar with. Positive social interaction. So if you're the kind of person that likes to exercise with other people around you and you feel better because it just makes you feel more secure within yourself, then you'll have more positive results from it because you have positive social interactions around you. Improve self-concept and self-esteem. So it can boost your self-esteem if you're exercising and you do it right and it works for you. And it can be fun. So opportunities for fun and enjoyment. Exercise and chronic diseases. So it can help with regulating certain diseases. So it has been linked to positive effects on people with these conditions. So HIV, multiple sclerosis, cancer, Parkinson's disease, diabetes, coronary heart disease. Personality. So changes in personality. So in a review of literature, McDonald and Hodge found that aerobic fitness training increased scores on self-sufficiency and intelligence and decreased scores on insecurity. Interesting. Development of the self. Exercise related to participants' self-concept, self-esteem, and self-efficacy. Regular exercise is related to increased self-esteem. Esteem enhancement effects of exercise, especially pronounced in people with low self-esteem. So there is an increase in the development of self through self-esteem. So if you have a low self-esteem, you have the opportunity to increase your self-esteem through exercise. There's increased positive changes in self-concept, so how you view yourself, what you think of yourself, and these are associated with participation in physical education and directed play, so like sports. Exercise programs assigned to enhance self-esteem should emphasize experiences of success, feeling of increased physical competence, and attainment of goals. Exercise and hardiness. Hardiness is a personality disposition that involves a sense of personal control, commitment, and purpose, and the flexibility to adapt to unexpected changes. Exercise can help protect against stress-related illness, especially for hardy people. A hardy personality and exercise in combination are more effective at preserving health than either alone. So hardiness is like we were talking about the different factors that go into personality. So you're in control, you have a purpose, you're committed, you're it doesn't upset you when you can't do something right. You just continue because you're determined. So exercise can help protect against stress-related illnesses, especially for people who have that mindset that they're go-getters. Exercise programs conducted over long periods are associated with moderate gains in cognitive functioning. Acute aerobic exercise increases executive cognitive functioning and planning and problem solving. Aerobic physical activity has a positive effect on cognition and brain functions. Executive central command is most affected by aerobic exercise. So again, going back to how a lot of the research has been done with studying aerobic exercise and how it affects people. So it has been meant to have a positive effect on mental function. Acute exercise increase cognitive function in the form of working memory only for people low in working memory. So there's an increase if you have low working memory. Moderate to vigorous physical activity enhances executive function in children with ADHD, so it can help with behavioral problems as well, which also has to do with mental function. Integrating physical activity into the classroom produces increases in children's intrinsic motivation, perceived competence, and effort. So making kids play games that require effort and moving their bodies can help them feel that control that hardy people feel. So, and then feel intrinsically motivated. So motivated because they want to be motivated, because they're doing it for themselves and not because somebody else told them to. Cardiovascular fitness and cognitive functioning in the older adults. So it also has good effects for older adults. The effects were seen the largest for the tasks involving executive control, so like planning, scheduling, working memory, and task coordination. Since we do have more responsibilities as adults, it can have very good beneficial effects for us because we are that much busy. We have to have more control over many more things than probably kids would. So fitness training combined with strength and flexibility programs have a greater positive effect on cognition than fitness training having only an aerobic component. So it's most beneficial to us to have more than one type of training because it does affect us on very different levels, and we do need different functioning than do young kids because we move and think in a very much more complex level than do young kids. And effects appear to occur more in females than in males. So the sessions have to be longer than 30 minutes to experience the largest amount of effects. Can help with aging, and it is larger for older adults than it is in the general population because as we age, our body changes and we're not as strong as we used to. So a lot of benefits can come from exercising if you are an older adult because it does help with the aging effects that are already happening. So it can help increase the quality of life, just how we live, through enhancing our mood, through behavioral functioning, through mental function, and just helping us do what we do every day. If you're physically active, you are more likely to report a better quality of life. Can help people in the workplace feel better, taking time out for themselves to work out and better their mental health, their physical well-being, their psychological well-being, even with college students. And there's obviously a difference between physically active and inactive people because people that work out obviously have a more they feel like they have a better sense of control over their lives because you have to make time for it, and it's something that you do that's good for you, and they tend to have a more positive attitude towards their own work and report a greater ability to cope with stress and tension because you do release tension when you work out, depending on how much you work out. Exercise produces small increases in the total sleep time, although it has no effect on how long it takes to fall asleep. So it may help you increase the amount of sleep total, but not how long it takes for you to actually fall asleep. So older adults who are physically active versus inactive report greater life satisfaction. So again, going back to that quality of life. Social demographic variables such as income, education, marital status, and age are not significantly related to the perception of quality of life. Exercise programs contribute to a person's quality of life by influencing effect, perceived stress, physical health, and life satisfaction. Psychological benefits of exercise. So there's the increased levels of self-esteem and self-concept, increased feelings of enjoyment, decreased feelings of physiological and psychological stress, increased feelings of self-confidence, elevated mood states, and decreased levels of anxiety and depression. The runner's high. So the runner's high is that sensation you get when you feel your best during a run and you transcend time and space. It's only happened to me once. I'm not going to lie, I'm not a big fan of running. And so going back to the statistics, so preliminary results out of Germany provide initial evidence that there is a chemical change or a release of endorphins in the brain related to the runner's high, which are like the happy hormones. Characteristics conducive to the runner's high are few distractions, cool, calm weather, and low humidity, and a duration of at least 30 minutes. You have to be running for at least 30 minutes to experience runner's high. Runners differ regarding whether and how often they experience the runner's high, but require slightly different sets of conditions to get it. So not everybody is going to experience the high at the same condition or during the same time or the same type of exercise or environment. Mirrors and no mirrors in exercise settings. So this is going back to self-esteem and how people perceive themselves. People who are sedentary and have poor perceptions of self tend to focus more on how they look, which appears to result in increases in negative effects, and these heightens a perceived discrepancy between the actual and the ideal physique. There was not a negative effect on social physique anxiety with women who were generally more active and confident in their ability to exercise. Exercise is an adjunct to therapy, so getting therapy as well as exercising. Because it can't be attributed to, again, there's not a cause and effect relationship between exercise and the reduction of anxiety or depression or any other disorder. There is a positive correlation between the two. So it cannot be used to treat these specific diseases or illnesses as like the single treatment. There are other things to take into account, like the client's exercise history, whether it's good and bad or bad experiences. You have to provide a precise diagnosis of the psychological problem, use an individualized exercise prescription for duration and intensity and frequency of exercise per the individual. So no single program can be used for a group of people. Evaluate the influence of family and friends to facilitate support. So they need to have a support system. Develop a plan for any lack of adherence and irregular patterns of exercise. Make exercise practical and functional. Encourage exercise as an adjunct to other forms of therapy. A multimodal therapeutic approach is more effective than the use of a single intervention. Include a variety of activities which enhance adherence to the exercise regimen. Also, exercise therapy should be done only by qualified professionals. No exact criteria for training have been established. It is suggested that formal training and practical experience in both the psychological and sports sciences are necessary because of the multidisciplinary approach to treatment. So there could be multiple things that one's use to enhance the benefits of psychological benefits. So not just exercise, but adding other things, other factors to it. So that's it for today. If you have any questions, don't be afraid to contact us, the TAs, or Andreas.